friends. Today we're talking about something super cool called pronouns.
Not interested, sir. Anyways, here's how to tell if your sign is cheap.
Like, I'm a trans man and I'm gay and I have been...
So you're straight. Anyways, watch me put it down like this. The design is very human.
So I got served today at the pharmacy and
Sir, here's how to tell if your LED sign is cheap, sir.
You're a fake ally, you're a fake liberal, you're a hypocrite, and I feel sorry for your trans friends. I feel sorry for your trans friends.
I don't have any trans friends. Anyways, here's how to tell if your LED sign is cheap.
Little one asked me, Mommy, what's a girl? Mommy, what's a boy? What makes somebody a girl? What makes somebody a boy? Baby, I'm a they, them. I have no idea.
If you have a penis, you're a boy. Anyways, here's how to tell if your sign is cheap.
How someone identifies. My pronouns aren't preferred. They are mandatory.
Anyways, if you don't know how to take a business to the next level, come see us with this ultra-thin light box.
You have reached a pronoun checkpoint.
Not interested. What's up, homie? I'm Tony. If you want to start a business on a budget, make sure you go to the Source Factory.
Many people ask me, how do you use they, them pronouns for a singular person?
Anyways, if you want to order signs for your franchise stores, make sure you buy from a responsible sign company.
When I got my cake pops removed, I specifically asked my surgeon to leave the bag.
Anyways, here's how to tell if your sign is cheap.
Okay, I'm about to show some boy pictures. Be normal.
What's up, homie? Hope you never change. Come check out our perfect marquee letter.
I want to talk to the kids.
Nope. Anyways, if you want to order signs for your franchise stores, make sure you buy from a responsible sign company.
You walk into your new classroom to meet your teacher and you see me. What's the first thing that comes to your mind?
I'm homeschooling. Anyways, if you want to order signs for your franchise stores, make sure you buy from a responsible sign company.
I'd turn around too. I'd say no on the other question. All right. I was supposed to do a live with Denise Long, who was running for Senate. Her website was having issues, so they had to address that. Should switch glasses here. These ugly. But Saturday, I have another House Representative, Ms. Jackson, coming on Saturday at 5 for your schedule. So I'm going to do more on this. Exulansic is covering this. I'll play a couple other videos first that are very important ones. Someone who's gone through the whole trans thing and talks about how they harmed him into thinking he was a woman, and it's just crazy. This interview is pretty important. Here we go.
I medicalized 17 years ago at an LGBT center. I'm a CSA survivor. Doctors told me that what was wrong with me and how I felt about my body was not from CSA, even though I went there and said, did CSA make me this way?
CSA?
Yes, a childhood sexual assault. And they said no. They said no. They said being gay is innate and being trans is innate, and what you have is gender identity disorder. They diagnosed me with gender dysphoria, and I believed their bullshit for about 17 years.
Wow. So for you, I mean, to what extent did you go through an actual are you willing to tell me everything that you went through?
Yeah, so I had FFS, I had SRS, I had an orchiectomy, I had facial feminization surgery, I had sex reassignment surgery, I was on HRT for 17 years, now I'm on a combo dose because I can't go off. I have multiple health conditions from transitioning young and for transitioning for so long.
Wow. So what was it for you that kind of woke you up to this isn't what I should have done?
I found out that homosexual transition was environmentally caused in almost every single case by childhood sexual assault or by internalized homophobia or failed boy syndrome. 92.5% of trans-identified males are straight and bisexual, and the only explanation for a straight or bisexual man to transition is autogynephilia. So from my perspective, I went there and I was given a blanket diagnosis given to anybody who has a body issue as a child nowadays.
Did they ever try to refer you to like a therapist or any?
I went to therapy for a year. I saw psychologists. I was diagnosed. It took a year back then, not 15 minutes. And I was in the South on the East Coast. But they still believed that transsexualism was innate, that gender identity was this innate disorder that people just had. And like CSA didn't really rule you out.
So, you know, this is your experience. You actually went through this and you're still I mean, you still have the effects of it. How do you find your story received by people who continue to sort of push medicalization?
They hate me. They call me a bigot. They say that trans women are women. They say that gender dysphoria is a valid diagnosis. I've combed through trans history. I've read all of the old academics who created this. If you go back to like the early 1900s, transition was conceived by old academics who were trying to find a way for homosexuals to exist in a fascist world in Europe. Havelock Ellis, Magnus Hirschfeld, that's why it was made. It just so happens that AGP is also real. And that got latched onto. A bunch of AGPs transitioned, and fast forward 100 years ago, and we have 100 years forward, and we have an ideology that's based on lies that kids are told to as soon as they have issues. And God forbid you're effeminate and you believe that something's wrong with you as a man because you like pretty things and are sassy.
So how do you identify now?
I'm a gay man.
And I mean, for people around you, have you lost friends or anyone by detransitioning?
I was canceled by every friend I had who was liberal in this city and had to leave the city.
And you live here?
I live outside of the city now because I had to leave.
So how old are you now?
I am 34 and married.
What is the message that you would send? I mean, obviously there's protesters here. You know, Riley Gaines, she's not necessarily talking about transitioning and all that. She's talking more about men and girls sports. But for you, what do you want people to know by hearing your story, that you're willing to come here, even though you know that your message will probably make them angry? Why is it important for you to be here?
Because people are being lied to when they're being diagnosed. They're not being diagnosed with what actually causes the gender dysphoria. They're just being diagnosed with a symptom of a problem. And there are multiple problems that cause those symptoms. And when you don't appropriately diagnose people, you lead them into a life of ruin. All of these interventions are permanent, they're irreversible, and they lied to me. I want people to know that they're lying to people. They're not diagnosing autogynephiles as autogynephiles. I have friends who medicalized all the way and are self-admitted AGPs who were never diagnosed with the reason they feel this way. They were just transitioned.
Who do you blame for that? Is it the doctors? Is it politicians? Is it the media? Who do you blame for this sort of fast tracking of medicalizing children?
I think after gay marriage was won, there was an empty hole in gay politics. We had gotten everything we wanted, and I think trans jumped into all of the orgs that were associated with the gay community, and they lobbied to make gender identity a protected thing. They started doing that in the 90s, and I think this is a byproduct of the trans community intentionally watering things down and lobbying so everybody can have access, and they don't care about the people who are indoctrinated, who are harmed by this loosey-goosey system where you can walk into a therapist in 15 minutes and be given a gender dysphoria diagnosis.
And what do you think it'll take to fix it?
It's going to take lawmakers to step up and shut it down.
My question had been, and you started addressing this in your testimony, what was permanent?
Yes, so this bill addresses both puberty blockers and cross-sex hormones. Cross-sex hormones are being given to children probably as low as 12 to 13 here. All cross-sex hormones are completely irreversible, meaning in a girl, if I give a girl testosterone, what will be completely irreversible is voice. So we heard Elle's voice earlier. It is going to actually permanently change and scar and drop the vocal cord, creating an Adam's apple. That's completely irreversible. That can never be changed back. This gets a little bit graphic, but it also is going to create growth in the clitoris, growing it into what's referred to as a microphallus. So most women's clitoris is actually protected inside of the vagina, inside of the vulvar tissue. A microphallus can extend beyond that. I had young girls who could no longer wear blue jeans with comfort because they were constantly having chafing and pain from the growth of that microphallus. That will never be reversed. We also know that most people that we give testosterone to, about 70% will go on to have permanent effects of their urethra, their vaginal canal, their uterus, and their ovarian tissues. So we used to recommend anyone started on testosterone should have a complete hysterectomy within 5 years. In my own practice, we saw young women who we put on testosterone who had their first sexual encounter, who had their vaginal canal actually completely torn open, and they were required to go into emergency surgery because those tissues require estrogen, which most middle-aged women know. When we go through menopause, things get dried out, we need estrogen. When we do that to young girls, we create a friable environment where those tissues actually become so degraded, they will tear open and basically can be permanently harmed. Almost all people that stay on testosterone long enough will report urological concerns and significant bottom concerns. In the boys, they will develop breast tissue that will grow on their chests. And the only way to remove that is to surgically go in and remove the breast tissue. We see changes to hair patterns. There's a significant number of young women we put on testosterone who will develop male pattern baldness at a very early age, things that actually does matter to them. And things like even a voice change. It really matters that a young woman has their voice permanently changed at 12. I have younger detransitioners who don't even want to call places like the bank because they will be told, this can't possibly be you, that they are told that their self doesn't match because of the mismatch of their permanent voice. I've also had detransitioners have to go in to have vocal surgery because it's very painful to have your vocal cords dropped in such a way through a hormonal intervention like this. And then the long-term impacts, most patients who are hormonally disrupted in these ways will go on to have other endocrine conditions. So diabetes, pre-diabetes. We were screening patients for sleep apnea because we were seeing changes to their weight. Blood chemistries change really significantly. Cholesterol. Essentially, we don't know how much, but we're taking years off of these patients' lives. So we might be reducing their lifespan by upwards of 10 years just from the known issues that we are intentionally causing by disrupting an endocrine system.
Yep, they're killing our kids. I was supposed to be on with Denise Long. She's running for Senate in Illinois, but her website was having issues, and they had to address that. People trying to donate and stuff for her to run for the Senate in Illinois. It's an open seat actually there. It's going to be. And so she has a shot at it. And then this Saturday programming note at 5 p.m. I'm supposed to have on Mrs. Jackson, who's running for House seat. That's coming up also. But this was my backup plan to run these. I was thinking of running them next week, but this is all about the testosterone things that they're doing to all these young women mostly, and to men, how much harm they're doing. So I'm going to move on to the Metoidioplasty they do, which is plastic surgery, basically, what they're doing to these kids, and the testosterone and the other harms it's doing to them, and some of the side effects and things they can't reverse, and them dying young and all that kind of stuff. This is Exulansic.
Come here, Rupert. I'm going to need my emotional support cat for this one.
Hello, everyone in chat. Can't individually say hi.
Meow, meow, meow. Okay.
So,
as many of you know,
there's a friend of mine. She's had a lot of harm done to her by taking the testosterone. She's never had the surgery, but it's shrunk her brain. It's going to cause dementia in her life, bone loss, many of other things, speech issues that's caused by it. So, and thanks everyone for coming. I was hoping to have that candidate on it, but about an hour ago, her website went down, and well, it's been down. They found out about it about an hour. It's been down for a week or something like that. We're wondering why no donations and stuff were coming in. So, all right, we'll go with this subject for today. But Saturday, I should have a really good show, and also we're looking at early next week for the Senate candidate to come on.
Oh, and hi, I'm Exulansic. I make videos about first-person narratives regarding experiences with transgender medicine and related topics. And I have been following this person named Elliot, who goes by Pigeons and Fries, for the past few years. And Elliot first came on my radar because she was a seahorse dad, meaning she had gotten pregnant on testosterone as a trans person. And so even though she identifies as a man, she was pregnant and decided to keep the pregnancy. She went off testosterone as soon as she found out, and says that she was under the impression that it was impossible for her to become pregnant due to the testosterone, which is an impression that doctors sort of give these girls because they are told that it will suppress ovulation and suppress menstruation. But of course, it's not approved for that or any other purpose in women. So in any event, she became pregnant from having intercourse with her male partner. And after giving birth, she went back on the testosterone, and then she got a metoidioplasty, which didn't go well. And she had to have some revisions. She got an infection at one point. And throughout all this, there were some serious concerns about whether her daughter was being neglected. Recently, she reported that she had needed over 50 stitches, and she referenced something about Suicide Awareness Month when she was disclosing this, but she didn't explicitly say what actually caused her to need 50 stitches. And then after that, she reported she was starting electroconvulsive therapy, otherwise known as electroshock therapy.
Health and final ECT appointment was today. I wish I could say I feel better, but...
And then right before she started the ECT treatment, she also announced that she was planning to get a phalloplasty.
Can't wait to be on Fox News, but I regret my bottom surgery.
Regrets collect like old friends.
Been thinking about this for a long time. Went over it with my counselor, so that was nice. If you don't know, which I'm sure a lot of people don't, there are two types of bottom surgeries, and one is a lot more involved than the other. From the time of submitting my paperwork for a consultation to getting WPATH letters, insurance authorization, all that fun stuff took almost 4 years. And I said, hey, let's choose the easy one.
The fact that they give you a choice is part of how they reel you in. It's a sales tactic. Because by the time you're thinking about which one would I prefer, you've already crossed that hurdle of kind of deciding to buy it, and then you feel invested, and then you don't want to disappoint them by backing out, and it's a whole thing. But there's no easy way to have your genitals flayed.
Got through all 3 surgeries. That whole process was about 1.5 years. Everything looks great. I'm not gonna lie. Like, my surgeon did a good job.
Really, was that before or after they did such a good job that your labia rejected the nudical implant?
I was thinking less surgeries means less complications, which isn't true because I had complications anyway.
Great job, Elliot surgeon.
I was worrying about if they could even take a graft from my arm or my thigh because I have so many scars.
Boy, yes, it's another trans man with self-injury scars that end up on her skin tube graft, which is, it's not the first or the second or I think even the third time that I've covered one like this, so it could be a whole playlist right now. By now, it's a genre.
Not everybody fits in the bad bitch genre. It's a genre.
I was worrying about my husband's time off work because we had a 3-month-old.
Yes, you had an unplanned pregnancy that was a direct result of gender affirming care, combined with your own ignorance of the medications and how they worked, and what was possible physically. And your persistent mental fabrication that you're a male, that was backed up by documents that caused you to really truly believe that it was impossible for a female and a male to have intercourse and for the female to get pregnant as a result. How old is your daughter now? At what point does she become the focus of your attention?
Surgeon told me that it was one or the other with surgeries, so I was like, damn, like, now I really screwed up, right? My in-depth 30-minute Google search said that that's not true. Very unfortunate way to learn, but easy isn't always better.
Think of all the things she's going to learn when she gets her phalloplasty that's going to come on the heels of a suicide attempt that was not prevented by gender-affirming care.
But instead of continuing to just feel bad about it, I guess we start over. back to square one with consultations.
There's no way back to square one physically. Your body is your body. You get one shot, one bite at the apple. You can't press undo, and you can't hit reverse. You can't even press pause. You can only go forward, and you will accrue damage as you go through your life, and eventually the damage will overtake you and you will die. And she is in complete denial about that because her mental illness was not addressed prior to initiating these experiments on her. Her underlying mental illness that she has disclosed includes borderline personality disorder as well as gender dysphoria, and may include other illnesses that she hasn't disclosed, but she seems pretty open on the internet. And so she now, very recently, her most recent video, she has disclosed that she got the electroconvulsive therapy as a direct result of the incident where she needed, and now she's saying it's 65 stitches.
The first round of being off work, it wasn't for ECT, it was for 65 stitches that I got, which is why I went to get my brains out. Anyway, enough about that.
And so the only reason electroshock therapy would help prevent another incident like that is if the incident was a product of self-harm. So it seems like that was either a suicide attempt or an episode of severe self-injury that she acknowledges nearly killed her.
I'm gonna go start dinner. That's about all I've got for now. I'll try not to disappear forever again.
And her daughter at this point is still 2, I believe. She may have. She was born in 2022, as I recall. That's when I was first reacting to her content, and I'm just scared because she doesn't look well, she doesn't sound well, and clearly it's not a safe situation. So I don't know what the custodial situation of her daughter is at the moment, if they've decided to have them live apart. But I'm just scared for this situation for both of them. And they're probably going to give it to her. And so my question is she still on the testosterone throughout all this? Are they still keeping her on the drug that's suppressing her brain function while she is so mentally destabilizing that she is severely injuring herself to the brink of death, where they see no other solution as electroshock therapy? Did they try stopping the drugs? Have they tried pulling back on the gender experiment? Or is she like, are we just going to keep experimenting on her until her body gives out, as it appears to be doing? And what's being done to protect baby Salem during all this?
I do, however, need to start making and showing art again after months off work. Let me show you the stuff I've been making.
So this next one that we're going to look at today is a bit concerning. Superficially, it's a Metoidioplasty Moment, it's a mastectocism, it's a Testosterone Tuesday. But what's concerning about this one is that there's an infant in several of the videos, and that infant was conceived to a mother who was using the known teratogen testosterone at the time of conception, and for, by her estimate, 4 weeks into the pregnancy. And this infant has already lived through a formula shortage. She'd had the glands that produce milk removed from her body for cosmetic reasons. And I'm hoping that somebody watching has more experience with this end of the lifespan than I do. To me, that seems like there's some red flags for developmental issues. So I have concerns about this child, especially since the mother is still prioritizing these cosmetic surgeries over the infant. Let's take a journey. 10 years ago, she got her first short haircut and started really questioning how she felt. Started going by a different name. Met my future husband. 2 years after seeing an affirming counselor, I came out and started using he, they. Changed my name to Leo and started paperwork to make it legal. Top surgery May 20th, 2019.
See, she was a woman, and they're trying to make her into a man, but she still ends up with a man. They're determined on this whole making a lot of money and cut down on the population of the world.
1 year on T and feeling a whole lot more confident. Back home and back on T, changed my legal gender marker to M. Scheduled my bottom surgery. That got postponed when we found out we were expecting a baby, which she was on testosterone for the first several weeks by her own account. Salem was born and got to restart T. And rescheduled my surgery for November 30th, enjoying being a dad.
Hey, so I've been thinking about making a video about how it's been to be pregnant as a trans person, and I've been putting it off, but today was the day I was supposed to get bottom surgery, so I think it's a good day to do it. I'm kind of disappointed, but it's not the end of the world. I'm rescheduling for December, and then if I need to push it out more, I can, but it's not completely canceled. I think the harder part so far has been having to stop testosterone for the last 4 months. It might just be me, but I feel like my face shape looks different now, and my voice makes me uncomfortable again. There's also a pretty high chance that I will have to get top surgery again, or at least a revision afterwards. It is possible that once I start testosterone again, it might go away, but there's a pocket that they left down here of tissue the first time they did surgery, and it's gotten like bigger, more exaggerated from hormones. So hopefully it will fix itself, but we'll see. I'm not sure how that's going to work. Surprisingly, so far, the doctors that I've visited have all been really good. Even when I had to go to the ER when I was really sick in the beginning, everyone's been really respectful, and I have not been made uncomfortable for unnecessary reasons. Because obviously it's their job to do certain exams and tests and things that I normally would not willingly go in to do. The papers and everything they give you, all the pamphlets and stuff, they do all say like woman and mother and everything on them. So I didn't keep any of those, but I don't expect them to change all of their stuff because my situation is not very common. The worst part so far that is out of my control has been insurance. Insurance still covers things based on gender. So because my legal gender is male, they are saying that they will not cover my prenatal care or any of the tests I've done. So I've been fighting them on that for over a month.
She's a female, and she's pregnant, and the fetus needs care, and it's time-sensitive care, and she's having to spend this time fighting with the insurance company because of a legal fiction that she's not actually a female. But of course she is, and now reality has set in. She created this problem. The government enabled her in creating this problem, and the baby is the one who's going to have to bear the brunt of the consequences.
Now, and that's stressful because I don't have unlimited money, and when you're trying to prepare for a baby, that's expensive as well. Let's see. I have to out myself to a lot of people now, like my fiance's family. That took some explaining. Anywhere I work now, because I'll need time off, and insurance had to know, and doctors already knew, but not all of them, so they all know now. On here, I'm more open about things, but in person, people will switch up real fast and treat you different, so I'd rather just let them wonder if they do and not tell them outright. So yeah, it's a little more stressful and expensive than I think it normally would be, but I'm about halfway done now, so we're getting there.
Wow, so she's not even telling all of her doctors that she's female and taking a drug to look the way that she does. And now she's having, as she said, to out herself to get her needs met. And her needs, of course, are rooted in the fact that she's female. And it doesn't seem to have occurred to her that people might not appreciate finding out that they've been misled.
One of the things that I have not really talked about with surgery is how much it costs, and there is a reason for that. With a Performing surgeries, like any surgery, there can be a big price range based on the area that you live in, the person you go to, the type of place you go to, if they take insurance, and if they do, what type of insurance you have. From my research, there are two types of places that you can go. One being a surgeon through a hospital, and one being a plastic surgeon. Plastic surgeons typically do not take insurance, but the overall bill from a hospital will be more, and then once you use insurance,
Now remember, this is a lady that's with a guy that was talked into that got pregnant after thinking she was a guy to be with a guy. So this guy wants to be with a woman who's going to become trans. So they're doing all this harm to the kid by having a kid and then trying to be trans. And she was taking some of the testosterone beforehand and all this and that. It's so mental that they were talked into these in colleges, mostly, and somewhat in schools, to do all this BS. That's how, and then a lot of it's being paid for by our insurances. We got to get that stopped, and the designation on the license and all this and that to get that switched to a male, even though she's a female, and all that kind of stuff. And of course, the side effects, this and that, we'll be paying for that for years. The rest of their life, we'll be paying for the drugs for all that. So
it's typically less. But again, that depends on insurance coverage, so it could end up being around the same. And if you went to a plastic surgeon here in Michigan, it would be a lot different than if you went to one in, say, California. To use insurance, you usually need approval letters from counselors. It used to be one, now it's two, and these letters are basically a dysphoria diagnosis. They are submitted to insurance, and then insurance can deem it medically necessary and will cover the procedure. I'm not sure if they ever cover it all the way, but that's where it comes down to whatever insurance is. Copays and deductibles and insurance being complicated as usual. You also have to take into account consultations, travel costs, post-op appointments, anesthesia bills are usually separate, any medications you might need after, a lot of stuff. For my top surgery 3 years ago, maybe around 4 now, I only needed one surgery letter, and my surgeon was at a hospital that was local. I also used my parents' insurance, and after everything was all processed and done, it ended up being around $3,000. But someone could pay a lot more than that, or they could pay less than that. For this surgery so far, I have only seen the surgery bill, and that has been around $30,000. Getting the 2 letters was about $1,000, and I do not know about travel costs and everything. I haven't been keeping track. Once the hospital bill portion is added, it's probably going to be about $70,000. But after insurance, I'm not sure. It's also one part of a 3-part surgery. I am estimating after insurance, it is going to be approximately $10,000, but this surgery can get up into above $100,000. So it's not really an answer that I'm able to give. Especially for other countries, I'm in the US, I do not know how it works anywhere else. When asked how I afford it, lots of saving, lots of working, and some help from people on here. Because for a lot of people, crowdfunding is unfortunately the only way. Sorry I can't be more helpful on this, but it's just a hard thing to determine.
Text reads, people stop talking about the formula shortage. Meijer, Target, only liquid and specialty formulas. Walmart, found one 12-ounce can, sold out online. And of course, none of those formulas are going to have the antibodies that breast milk has in it.
So Salem is 3 months old today. She's getting extra chunky now. She's kind of started to realize that she has hands and she stares at them all the time. She still wakes up usually every 2 hours to eat and will only fall asleep after screaming for at least 4 hours, sometimes up to 7. So we're kind of losing our minds about that. But hopefully she'll grow out of colic soon. We did have one day a couple days ago where she slept 5 hours at one time, and that is unheard of. I took her 3-month photos, and she's in squashes because it's November.
You can hear the baby hiccuping in the background. it's not pleasant to have that level of reflux. And in another video, she says that the baby's actually already on medication for it, which says that it goes above and beyond what they normally expect for a baby.
Also, my surgery is in 2 weeks now, and I was really hoping that she would be sleeping longer periods of time, but that has not gotten any better. Maybe we'll have some miracle in the next 2 weeks, but I doubt it. It's going to be rough. To prepare for surgery, I've been trying to make some stuff, but with her screaming all the time, it's been hard. I did make some of these little moons. There's an obsidian one. The new worm stickers are here. But besides that, I've been mostly doing customs and trying to sleep whenever I can. I also have a GoFundMe for my surgery that I started like a year and a half ago. I think we're like 70% of the way there. But yeah, I think that is all. I'm gonna see if she'll take a nap because she keeps yawning. Have a good day.
When you're a parent, you're supposed to prioritize the baby's needs above your needs. And she is prioritizing making these trinkets to sell so that she can partially contribute to funding this exorbitant genital surgery, the first 3 apparently, as well as her drug habit that she's currently taking without a prescription, as she said in another TikTok. See the part 1 of the Testosterone Troubles for this one. And she seems resentful of the baby's presence. There's going to be a lot of expenses associated with that baby. Is it really wise for her to be signing up for health problems she doesn't need and spending what little money she has to pay for them? Is she thinking clearly?
Go to a hospital that prides itself on being a safe place and inclusive to LGBT people. They have a whole page for it on their website, and good for them. Many of the providers that I have gone to have been great people, but I find it interesting that they say they are so inclusive, and yet their system, the computer system that they all use, doesn't have the option to have same-sex parents.
So the mom's gender issues, mom's inability to recognize that she is a female in a relationship with a male, already led to one unplanned pregnancy that meant that the fetus was exposed to cosmetic doses of testosterone based on these videos and my interpretation of them for the first several weeks of the pregnancy. And now the baby that resulted from that, according to her, is showing signs of developmental issues. And she still can't understand why perhaps there's a reason that the medical office software doesn't allow people to input foolishness. Maybe it's important that everyone remembers who the females are. Maybe it's not all about you.
They listed me as mom, and
No, this person can get pregnant again right now. How messed up would that be if they had another kid, a second kid this way? Get a clue.
and whenever I call them, when I give them my name, they use she, her, and mom. And I correct them, but I've asked for it to be changed, and they said it's not possible. They're just, no one knows how to do it. There isn't an option. For an inclusive, LGBT safe place, that seems like it would be pretty easy. And that's on her chart, not mine. But I have to be on there to be able to call and talk about her and pick up prescriptions and things like that.
So she doesn't just want this on her own medical records. She wants to be able to falsify her infant child's medical records in a way that will mislead other people around her. And in a way that leaves her with medical records that suggest that she doesn't have a mother. At some point, the child has rights, and the right to know your medical history and therefore certain medical facts about your parents is entailed by that.
In patients' charts, there are 3 categories. They have your identity, they have your legal gender, and they have your birth gender. So on mine, my birth gender is female. My legal gender, which is on my ID and my passport and everything, is male. And they are not allowed to change that because it is a legal document. It says that it has to match what's on your ID. For whatever reason, one of the offices that I go to keeps taking it upon themselves to change it. And my insurance has my legal gender as male as well because they have to match. So every time that they change this, all of my claims get denied. I think it's been about 4 or 5 times now I've had to change it back, and there's never a phone call to ask me about it, that no messages, nothing. It's just someone just keeps doing it.
What if we didn't allow people to lie on official documents ever? Wouldn't that solve this problem entirely?
This hospital also offers gender-affirming hormones and surgeries. I have never had a problem with my endocrinologist. Him and his office have always been wonderful. My surgeon himself was amazing. But when you go to get surgery, you don't go to like a surgery center. At least when I went, you go through outpatient surgery. And those are different nurses. Now, when you go in, they know what you're there for. And in your chart, like I said, you have pronouns and all that fun stuff. When you go in for a gender-affirming procedure, you don't usually expect to be misgendered the whole time. But I was. By the nurse put in charge of me, by the anesthesiologist, by everyone except the surgeon.
These medical tourists who are on a ride that they expect to go according to plan are so fixated on controlling the speech of the people around them and getting their money's worth in that sense, that it's not occurring to her that maybe the anesthesiologist doesn't want to screw up the dose and have you wake up on the table. Maybe that's why she's so fixated on things like sex, which actually matters for things like anesthesia.
The hospital says that they are trained on this, on how to deal with trans people, but I think they have quite a long way to go before they can really label themselves as a safe place and inclusive when you can't even have same-sex parents in their computer system.
You can't even have same-sex parents in reality. The computer system is not the problem. The problem is your inability to accept that a male and a female are what produces a baby.
Anyway, Salem is a bat today. She's got some little wings. There's a hat, but I can't put it all the way on her because she hates it. I'm not really...
One thing I noticed is that the baby never seems to be focused on anything. Whether it's objects being dangled, whether it's a sensation. We saw a bit of a flinch when she touched the baby's head. But withdrawing from pain is a lower level of development and consciousness than localizing to the sensation.
Now, are they going to transgender their little kid when that little girl grows up? She's saying that calling her a little girl. I don't know. What do you think?
She's about to trigger the rooting reflex, but the head moves in the wrong direction. So the rooting reflex is a primitive reflex that's designed to allow the baby to find the nipple. And so if the corner of the mouth is touched, the baby's supposed to turn and try to move its lips around the nipple. And so in this one, we see that she touches it, the lips kind of move, but then the head moves in the wrong direction. I don't know what's up with that. And then in another video, she touches the corner of the mouth and there's just no response.
Good morning, everyone. It is now 3 months that I've been back on T, so some changes. I just shaved, but my hair is filling out more in the in-between section where it wasn't before, and kind of more in this part where it stopped growing. One thing that I am not sure I've ever heard someone say, so maybe it's just me, but when you get more body hair, I've gotten so many ingrown hairs, and it's not painful or anything, it's just really annoying. So dealing with that.
The word navel gazing doesn't begin to cover it.
I just got my blood work done and my T levels were a little bit high, but my endocrinologist didn't message me or anything, so I'm not sure if I have to lower my dose or what we'll end up doing. But when your T levels get particularly high, it can make you aggravated, and I am already stressed with a 3.5-month-old, so I do not need that. But I have noticed that my patience is pretty thin lately, so I'm going to send them a message about that.
So we're starting with a woman that can't cope. That's why all these interventions are being done, right? That's what we're told.
is that she really can't cope. She was a high risk of suicide. We need to do anything we could to stop the feelings cancer to prolong her life slightly. Those are the ethics. That's the situation that we're told we're in, and why it's okay to be doing this to healthy people. So we have a woman who can't cope, and she had an unplanned pregnancy, and now she's got an infant. And in other videos, she's complaining about how the infant's screaming all the time, not sleeping for a very long period of time. In this one, she's insinuating that the infant's really stressing her out. And on top of that, she's on this experimental cosmetic dose of testosterone that's further stressing her out. Is this really, really a good situation? Could anything go wrong here?
My surgery is also in less than 5 days now. At this time, I will be out of surgery. We did end up having a little struggle with my mom being able to get days off. And so I'm still not completely sure that we have someone to watch the baby while we're gone. Might be some last minute phone calls happening. But I do know that one of my friends said that she can watch her the second day that we'll be gone. At least half of the time is covered, so that's something. But I will not be canceling again after 3.5, almost 4 years of trying to get this done. So one way or another, someone will be watching this baby. Even if my husband ends up having to stay home and I have to find someone to go with me to surgery, we'll work something out.
She's quite open about the fact that her priority number one is getting this metoidioplasty. And she'll eventually talk about the fact that the metoidioplasty is a vagina-sparing metoidioplasty, so she'll still be able to potentially become pregnant again while she's on. Entertaining the baby with crinkly things while
Harris, she's going to suffer so much later on, you know. It's going to be payback, I guarantee you, for all this. And the guy that's with her, it's stupid to go along with that stuff. I mean, it was a guy with a girl, and then they do all this shit, and they get pregnant, so they're having sex as a man and a female, and they do all this shit, you know. They're sold into this cult, and it is a cult.
packing the orders for my shop. The paper is her favorite. Baby is not tracking. Baby could not care less. Where's the rooting reflex?
Good morning. It is day 5 of recovering from bottom surgery. My face is starting to look a lot less swollen now. The inside is still gross though. It's all white. It tastes nasty, but it doesn't really hurt.
Yes, she also cheeked her privilege. She had a section of cheek taken out, and instead of using her labia and vagina to create the urethral lengthening, I'm assuming, they used the cheek for that because she wanted to keep her vagina. So they went straight to doing the cheek urethroplasty. That the phalloplasty people, they tend to wait till a failure to then use the cheek. So like I said in the last phalloplasty files, which is called the hot dog in the hallway, or with no hallway, they could just start with the cheek. They don't, because people make choices and they're buying a car so they can have whatever customization they want.
The worst pain is still from the bladder tube. It just feels like a UTI and it like burns. But I did get some medicine that's supposed to help with that.
There's no actual way to tell whether your urethra is inflamed because it's infected, or if it's just being locally irritated by a catheter when you have to wear a catheter. Right? How would you tell the difference? And I'm not very confident in this person's ability to perceive pain correctly. I'm just not.
And it hasn't been as bad as before. Everything is still very swollen, and my stitches have started to get a little bit itchy. So that's not fun, but it does get worse before it gets better. The staples come out in 3 days. I'm a little nervous about that. Overall, I think things have been going well. I can shower by myself, and we've gone to get groceries and things. It's still early, but no complications yet, so we're just hoping it stays that way. So today is day 2 after bottom surgery, and I have been sleeping most of the time. I was awake for a few hours today, but I get lightheaded after a while, so I had to go lay down again. I'm still not in much pain, but they did give me like the good pain meds, so that's been helping.
Yeah, I've talked any number of times about how this can easily, even if it doesn't start that way, become a vehicle for accessing pain meds, because they're getting surgeries, they're getting prescribed pain meds, and they're surgeries that they chose to get because they wanted them. So you're reinforcing a behavior of deciding that you want to go through it, and then having that be rewarded. And there's nothing stopping them from deciding they want to have other surgeries in the future. If you only give surgeries when they're needed, it's not something that's generated behaviorally by the individual. It's a product of circumstance. But this isn't a product of circumstance. This is a behavior that has a goal in mind, and you're adding to those goals when you prescribe opiates following the surgery.
And then I have lidocaine mouth rinse that makes my entire mouth numb, so I can't feel my cheek at all. I got to change my surgery dressings today, and I saw that I have a lot of staples. I have never had staples from a surgery before, and so that looks a little weird. Still very swollen. It's going to be for a while. I got my leg tube changed out to one that helps me walk better.
So this woman was already struggling to cope with the stress and demands of being a new mother, and she's literally handicapped herself now.
This one like straps, and it's not a small purse like the other one was. That way I can wear pants over it and be able to move around without worrying about pulling it or having to carry it. I made a little bit of an oopsie because I didn't tell anyone that isn't on TikTok or immediate family that I was getting surgery. I thought that would be a weird Facebook post, just a little TMI, since people on here follow me like for transition things, and then I didn't want to be like, guess what I'm doing. But anyway, I posted a picture on my Snapchat story where some family members do follow me. Just this dumb, like, I lived bitches. I was high on anesthesia and I thought it was funny. But I got a bunch of messages like, are you okay? Like, what happened? And that completely slipped my mind that not everyone on Snapchat knew that this was a planned thing.
She seems pretty contemptuous of the feelings that she created in other people with that oversight.
But anyway, I opened my shop again because my sitting region is compromised.
I believe the medical term is ding dong.
So standing is actually better while I can, and I haven't been able to make anything because I've been sleeping, but there's still a few chokers, a few pendants, and a bunch of stickers and stuff like that. I'll ease back into it slowly as I start feeling better, but the bills are also going to start rolling in, so I kind of gotta like get on it.
So she's got a baby, and she just paid who knows how much money, either in direct medical costs or ancillary costs, to have this cosmetic genital modification to make her feel less like a woman in some way, or more like a man in some way, or more non-binary in some way, whatever justification she came up with. And her job is selling like necklaces and chokers that she makes, which is a perfectly fine job. I'm not knocking that, but to hear her complain about the bills that are going to start rolling in, it's like, yeah. But you also have a GoFundMe for these unnecessary surgeries. So.
And now why I chose metoidioplasty. So this surgery actually has a lot of options. It's like custom designer PP. One of the main things that I wanted from the surgery was to be able to stand to pee. So I got urethral lengthening, which is why they took my cheek. I also wasn't worried about it being massive, so my bottom growth that I have from my years prior on hormones is what I'm comfortable with. And I can still get the scrotoplasty, and they let me leave the hole open, which I'm still going to get a hysterectomy. But for my partner and I, that was something that we chose to have left open. That does increase the risk of complications like fistulas, but we're just going to hope that things go well.
So she already had the experience of being on testosterone, having heterosexual sex, and conceiving a child. She had the baby. She's not breastfeeding the baby. She's presumably not on female hormonal birth control. And she still has not had a hysterectomy. And she went right back on testosterone apparently 2 weeks after giving birth. Do you think that she's being celibate when she's getting an elaborate genital surgery in consultation with what her male partner wants in terms of accessibility? You think preventing another unplanned pregnancy is a high priority for her, or has she learned nothing? She's got plans in the future, it sounds like, to get a hysterectomy, but is that going to happen during the metoidioplasty? Is that how high on the list of priorities is that? It sounds like not wanting it was part of the reason that she went against phalloplasty. It seems like she's setting up another fetus to have the same experience as the first child, which is to be exposed to a teratogen during early development.
So I guess in summary, this procedure, the metoidioplasty that I got, has both the functional and the cosmetic results that I needed, while also having less healing time and a less extensive procedure. And this person was only 2 hours from me. I went to Dr. Hajmusa at U of M, and being a hospital and not a plastic surgeon, they take insurance. As long as you have your WPATH letters from a counselor saying that the procedure is medically necessary. There are a lot of different options, like I said. So if anyone is thinking about getting it done, I would just say try to get a consultation somewhere and talk through it.
It's bottom surgery time. Dropped off Squiggle at my mom's. Baby is checked out as usual. My goodbye present was some puke. We got some sushi to celebrate. Back home in time to pack before bed. Sleep time. Now it's 2:30 and I need to shower with antibacterial soap. No piercings allowed. Took a minute, but they're out. Looks so weird, LOL. Only water this morning.
So I've been thinking about some things that if I could start over with her, then I wish I would have known. And my sister is also planning on having a baby, so maybe this can help. The first thing that I always think of is that I would never get outfits that have snaps. Zippers are better, but two-way zippers are the best. This one is a one-way zipper, so it doesn't have a zipper by the foot.
As usual, the baby is focused on who knows what, not the moving, talking parent.
Babies are very squiggly and they don't sit well enough for snaps. And if you get off by one snap, you have to take them all out and start over. You can never have enough burp cloths. So Salem has like reflux and she's on medicine for it now.
Acid reflux is not generally treated with medications in infants. The exception is when it's thought to be due to a developmental issue and when it's particularly severe as a result. So it's not pointing in a good direction that the baby has these problems. The weak muscle tone at the top of the stomach that may be causing this chronic reflux in an infant might be connected to the apparent muscle weakness in the face and neck and the reduced / sometimes absent rooting reflex. Has anyone connected the dots yet with the testosterone use early in pregnancy? What other substances was this person using when she was thinking of herself as a male in a homosexual relationship and not as a fertile female in a heterosexual relationship like she actually is?
So maybe that's why we go through so many. But babies spit up and drool and are just kind of gross and fluidy in general. Those little washcloth-sized square burp cloths aren't going to cut it. The best ones that we have are like almost a blanket. So when you lay it on yourself, they cannot puke on you. I swear they do it on purpose, but they will turn their head and puke onto you rather than the towel. There's probably more, but I'm out of time, so say goodbye. Salem is 4 months old, so I have an update for you. She's got some hiccups right now, but she's dealing with it pretty well. They usually make her mad, but she can chew on her hands now, so that helps. That is one new thing this month. She learned that she has hands, and she's very left-handed so far. She always eats her left hand, and the main hand that she grabs with is her left hand. She doesn't pick up toys by herself yet, but when we give them to her, she will hold them. There you go. She's also really working on holding her head up.
Babies should be able to lift their head up at 1 month old. This is a 4-month-old that can't lift her head yet.
And I'm not going to put her on her stomach right now, but I have a video.
Baby seems a bit cone-headed.
Today has been 8 days since my surgery, and I'm going for a checkup and getting my staples removed. My cheek is not swollen anymore, and it looks a lot better. It's still kind of gross, but they said about 2 weeks to heal, so hopefully we're getting there. It's a 2-hour drive to my appointment, but I got up early because we need to get her ready to go with us, and we're also leaving early so that we can feed her when we get there so she doesn't scream. Please don't scream the whole time.
So the baby is lying on its back, hiccuping like mad. Generally, if you have a patient prone to reflux,
I'll bet you money that they end up getting divorced. It's going to get worse before it gets better. That's for sure. What about the whole sex thing when she doesn't have a vagina anymore? For them to have sex. Just say.
You want them to be upright so that gravity can help keep the acid in the stomach. And then she leans down to talk to the baby, and baby just like stares into infinity.
Please. So I'm gonna get ready, and I'm gonna finish getting her ready, and then I'll wake up my husband, and we'll be on the road. I'll finish this after the appointment, and we'll see how things are doing. We just got back from my appointment. The surgeon said that everything is looking as it should at this point. I got my staples removed. It was uncomfortable, but it didn't hurt that bad, just kind of like pinchy. I also got a prescription to help with the only pain that I've been having, which is where the bladder tube is. So they gave me something that's supposed to help with like the burning feeling. I was going to ask if I can drive now because my discharge paperwork said not to drive while I have the tube, but I have the tube for like 2 months. I am not taking the hardcore pain meds anymore, so I would think it's okay, but I still want to ask. I'm actually going to the post office right now, but it is literally 2 minutes away, so that I'm not worried about.
So her discharge paperwork, it sounds like, gave her very clear instructions not to drive while she has this tube in. And further, she was just prescribed another pain medication, but it's not a hardcore pain medication. So even though she knows that she didn't ask whether it was okay to drive on it, she's just kind of decided that it's okay to drive on it. And so now she's going to go on a quick trip to the post office. It sounds like she appears to be in a driver's seat. And I don't know why else she would have justified the distance to the post office if she wasn't driving herself. So, and the concerning thing, though, is that even though they could have legal implications for her, she's still going to film it and put it on TikTok. It does not suggest strong judgment.
I go back in 5 weeks, I think. They'll check out everything's healing and do a retrograde urethrogram to see if they can take the bladder tube out. I really hope that will be enough time because I do not want this tube any longer than I have to have it. The longer I have it, the more chance of infection, chance of it getting caught on things, and dealing with that weird burning type of pain. So far, so good. I probably won't make another update on this for like a week maybe, because I would assume not much is going to change between now and then. And that is all. Have a good day.
I'm really wondering how she's going to differentiate like a normal UTI from the burning that's being caused by the catheter. Generally when you have the catheter being built, like you have the suprapubic catheter, that's the main way that you're draining the bladder fluid that she's about to show. But then there's also often a Foley catheter because you have to keep the urethra open. So I don't understand how she's so certain that she doesn't have a UTI if she's having burning pain in that area.
Today is day 16 after my surgery, so it's been a little over 2 weeks. My cheek is almost completely healed now. I have coffee teeth. It is normal color, and it has pretty much filled back in now, so there's not like a hole. I have not had to take pain medicine in a few days, and the burning type of pain, like the UTI kind of pain, has stopped. A lot of where the incisions were are completely closed now, and the stitches are dissolvable, so they're starting to kind of fall out. But there is one area that keeps opening, and it is pretty open. It's like the underneath part where they sutured it from the scrotoplasty. That part tends to move a lot from being like up and down with the baby and just walking.
So what are the odds that she ignored the doctor's instructions and decided that she felt well enough to move around anyway? And now it's splitting open. Just from the normal movements that are required of a new mother.
So I sent them a message because I don't know if it has to get resutured or if it's just going to heal on its own but take longer.
Yeah, it's just going to magically join back together.
It's been 3 days and I'm still waiting to hear back, so I might call them. But they asked me to send a picture and that was a little weird to do, so I'm just waiting to hear back. The worst part,
her judgment's really bad
right now is how itchy everything is. As these stitches dissolve, little ends poke out, and that skin is sensitive anyway, but now as things are healing, it's even more sensitive, so all the little ends poking out don't feel too great, and the itchiness is kind of driving me crazy. Still nothing so far that I would count as a real complication.
It's splitting open.
Since it did say that it's possible for some stitches to open up, it should be okay. I just want to get it checked out to make sure that everything will heal correctly. My next appointment with them is in 3 weeks, and then we will see if I can get the bladder tube either closed off or taken out, and hopefully talk about scheduling the next portion of the surgery. Not a very eventful update, but that is a good thing.
And how much did stage 1 of 3, not counting any corrective surgery she's going to need for the split open problem, that's definitely not a complication. How much did that cost the other people on this insurance plan? Let's find out. Me going on my account to see if my bottom surgeon responded to my message. She didn't, but for those asking how much surgery costs, this doesn't include the hospital stay. $92,791.26 for stage 1 metoidioplasty.
It has been 3.5 weeks since my surgery, and I only have 11 days left until I go back to the surgeon again. I am very much hoping that they will take the suprapubic catheter tube out.
So she's already been told that the suprapubic catheter will stay in for 2 months. And so 3.5 weeks plus 11 days is not 2 months. She's not that interested in following medical recommendations. She's interested in getting what she wants when she wants it, and she wants it now.
The places where the stitches had opened up that I was worried about, they don't bleed anymore. They're still kind of open, but it is starting to heal.
What does kind of open mean? Like, if they're not touching and they're healing, they're going to heal open. That's how it works.
They never did answer me back, but I'm not really worried about it anymore.
So remember, she asked them, hey, my metoidioplasty, which is a pretty small thing, it's visibly opening up and separating. What should I do? And they wrote back and said, send us a picture of it. And she decided, no, I don't want to do that. So now they've just ignored her because she didn't follow their recommendations to send them a photo. But they also aren't like scheduling her to come in to see it in person. So
if everything is healed enough when I go back, I'm assuming we'll talk about
We're going to end up paying for all this too. And they can end up dying from this stuff.
the second stage to the surgery, which is doing implants. But the part that had opened up and is taking longer to heal is where those are going.
So in other words, the labia are kind of sewn together. And remember, she left her vaginal opening open so that her male husband can continue to risk pregnancy with her. And apparently it's separating because that's the part that would be pulled when you get up and move around, which she's been.
There is also some skin left that I didn't think would be there. And at first I was assuming that it was just swelling and that it would maybe go away or look different when the swelling went down. And there is still some swelling, but it doesn't look like the pictures that I saw before getting the surgery done for what I expected that it would look like. And
yeah, so apparently it's such a botched job that there's just like a chunk of skin pushing out in some random direction. That's so noticeable that it makes the result, even not counting the fact that it's opening back up, not look like the photos.
Don't get me wrong, it doesn't look bad. Like, it still looks good, everything's healing well. It's just something that I'm going to ask about for possibly a revision, if that's doable.
What is her motive not to set her up for a revision?
That would also depend on if I needed more letters to get a revision and how cost works with revisions, because I don't know anything about that. If you saw my video that I posted last night, the total build so far is around $93,000.
As she said in one of the videos at the beginning of the video, going into surgery, she believed that the total bill would be about $70,000.
And they have not entered my hospital stay yet, which will probably be at least another $40,000.
That doesn't count all the meds we're paying for.
Her estimate was about half of what it actually ended up costing. And she still has at least 2 other surgeries planned, plus who knows how many revisions and how many complications between now and then.
And that's not like my responsibility. That needs to go through insurance and everything.
Yeah, so if you have unaffordable premiums, congratulations, you help pay for this.
But that is a really big number. And with my job doing Etsy, they don't take
income tax throughout the year. So in January, I am on the hook for a few $1,000s. And depending on how everything works out, I might not be able to afford to get a revision if it's something they can even do. So
that little kid's going to pay for it too.
Yeah. Can you afford all the baby formula you need for your infant?
Overall, everything is still going good. Healing
Thank
is
heavens you have a
always kind
husband
of
to help pay
annoying,
for some of
but
this.
it is temporary, and I
gonna
have
lead
been
to
feeling
divorce.
better enough to start making things again. Made this the other day, and this one actually. I got 2 done, but 2 of them took 8 hours, so it's more than it seems like.
When do you think she's actually going to get real about her need for steady income that's not based on making trinkets and selling them on Etsy? You know, it's a nice job if you can support yourself with it, but she's got a child now, and she's signing up for hundreds and hundreds of thousands of dollars of unnecessary medical debt and prolonged periods of disability where she's not able to work.
My sister and her husband just got here from Japan, so we're going to hang out and make some cookies and stuff. If you celebrate Christmas, have a good holiday tomorrow, but drive safe because it is very snowy in a lot of places.
As always, if you like what you see, you can go climb the link tree and find ways to support me. Otherwise, I will keep following the story and posting updates as they come out. It's one of the more horrifying ones that I've seen, and of course, we're nowhere near the bottom because she's got plans. She's got designs.
The next one's about testosterone and headaches. It causes headaches because it's shrinking your brain, your skull, and it's on women especially. It ruins their brains. The testosterone in that, and estrogen in men has other effects that's really bad.
All right, while I'm feeling dander euphoric, I'm going to film another quick one with Elliot. This is Pigeons and Fries. Just a quick update. See how she's doing. Elliot was the star of various Metoidioplasty Moments and Testosterone Troubles episodes, including The Accidental Seahorse, She's Come Undone, and Blackballed, as well as a couple update reels, including Pigeons and Lies, where she accused me of being an entire right-wing organization out to get her. All by myself.
Right wing. Now remember, she went to Berkeley and was a left winger. So here's an update on this. This is all the testosterone shots.
So she took a drug that causes bottom growth, and she then turned the debris from her drug use into art that represents the drug use, as well as the effects of the drug use, which is bottom growth, as represented by the purple moss,
I say
which
cut off
seems to
all
be
the money to
evocative
that
of a
stuff.
V and pubic hair. And yeah, it reminds me of a delirium. Happy Trans Day of Visibility. Do my T-shot with me. I've been out as trans for almost 10 years. After 4 years of hormone replacement therapy, 1 name change, and 7 surgeries, I now have the privilege to be mostly invisible in my daily life. I hope everyone gets a chance to do this, no matter where you are. Be proud of yourself. I'm proud of you too.
All my HRT supplies takes up a lot of space, so we're going to organize. First off, this is not sponsored. I found this bag by Stealth Bros. They make a few different sizes, but I got the medium one. Let's see how much fits in here. For this side pocket, I'm adding some Band-Aids. I did put alcohol wipes in there too, but I don't have any right now. Then the most important part, my vials of tea. These are pretty small, so they don't fit in the elastic, and I tucked them in the side pouch instead. For the back pocket, some loose needles. For the main pocket, my needles that have syringes. There's still some space if I need to add anything else. I'm happy to have this all in one place instead of multiple boxes laying around now. I have less chance of misplacing things if it's all together. It's more discreet, and best of all, is supporting a trans-owned company.
It's bad enough when you get my age and you have
And
to take a lot of
testosterone is not
vitamins.
the only drug that Elliot is doing. As Elliot's about to explain, doctors have also been throwing medication at her BPD, which I'm interpreting as borderline personality disorder.
Again!
Again!
But is there any possible downside to this level of drug use?
I get to wear a heart monitor for a week. So yesterday morning, I was like, I really don't feel good, but I might feel better if I just get through the morning. So
Here we go. Here's all the side effects that are happening. They're going to die young, no doubt about it. And that child's going to be motherless. It's actually the mother.
got to work, and I felt like I was going to pass out on the way to work, so I took back roads instead of the highway. And then one of the
It's not the first time Elliot's made a poor decision surrounding driving. Elliot was also told not to drive with a catheter and made the decision to drive anyway with the catheter because it wasn't very far. Here, Elliot thinks that she might fall asleep or pass out while driving. And does she choose not to drive? No, she chooses to endanger people on the back roads instead of endangering people on the highway, including
She also
herself.
has a daughter in the car.
This is something not quite firing, not quite connecting. Upstairs, why would it be better to crash from passing out while driving on back roads? Why is that better?
nurses was like, you don't look good. I'm like, I don't feel good. So instead of working, I got wheeled down to the ER and was a patient. Since August, I'll have days to a week or a little more sometimes of feeling like I'm having a heart attack, like chest pain, pressure, heart rate in the 120s, 140s when I'm sitting.
Jeez, I wonder why.
Sitting down, cold sweats, weakness, shaking. And it comes and goes. Like sometimes it'll just be kind of dull like it is right now and I'll be pretty fine. But then if I start moving around too much, then I'll my vision gets weird and I get the spots like I'm going to pass out. Anyway.
The list of things that this could be, given her medical situation that we covered in the first part of this video, is very long. And yet you're going to see that she gets the same treatment as other young women get when they go presenting with chest pain.
So I got down there, and this is
well, and they're pushing our kids into the same stuff. I know they're freaks and really sick, but that's being pushed in our schools. Now they're starting to push it down into elementary school.
My third time going to the ER for this since August. The first time they said it's probably panic attacks. You have anxiety. And yes, I have a history of anxiety, but I am on a lot of medication for it. I have had many panic attacks. I know what they feel like, and I would not have gotten out of the house if I was having a panic attack.
The idea that if you've had a panic attack, you know what a panic attack feels like is false. You know, my impulse is to even go so far as to call it a delusion. You don't know what physical events happening in your body that you've never experienced.
It's a woman on testosterone. That's the issue.
It's to feel like. And so therefore you can't rule out that you're having a panic attack because you're also having some sort of physical event. I just ran into this myself. Nobody's immune to this kind of thinking, to this kind of error in judgment about your health. Nobody's immune to it. Not even me. I just went through this. I dismissed what turned out to be pneumonia for a surprisingly long time because I told myself it was just bad anxiety. And because also I thought I knew what anxiety felt like. Well, it turns out anxiety also feels like what you feel when you have pneumonia because it's a bit stressful and anxiety provoking to be in pain.
Anyway, then they said it was anemia, which I was anemic, but I'm not anymore. So then they said it's dehydration. That's fair. I don't like the taste of water. I hate drinking water, but since then I've done a lot better about it.
It sounds like her doctors think that she can't really be relied upon to take care of herself. Like getting so dehydrated so regularly that your heartbeat is in the 140s for a week and you're not able to problem solve. This person's taking care of a toddler.
140s.
They gave me 2 bags of fluid. I got an EKG. They did a chest x-ray and that didn't show anything. I've gotten so many blood tests done for things like hormones, different vitamins, like TIBC.
Taking testosterone and being a woman, do you think that would mess up your hormones? I think so.
Like ferritin, stuff to do with being anemic. They tested me for POTS and did orthostatic vitals.
POTS is really sensitive to your hydration levels. So did they test you before or after they had pumped you full of 2 bags of fluids?
So hopefully this will give me some answers because right now I don't have any. And I can't keep missing work for this because my husband is not working right now and I can't afford to lose my job. Now before I would have been like, okay, I still have Etsy to fall back on, but that's actually costing me money now. So that's not helping.
I can see why you might feel like the walls are closing in, but that doesn't mean that you're not also sick.
So if this
Divorce is coming. It's going to come, and the financial burden of all this bull crap is really going to hurt him.
doesn't have answers, then maybe it's like a non-cardiac issue that's presenting with those symptoms. Okay, I know like GERD can do that, but I just need to know so that I can feel better, because I hate getting all these tests done and still just feeling like shit.
Elliot still has a healthy person's sense of entitlement to feeling better. Sometimes you get an answer and you get to feel worse forever. Sometimes they can't fix it.
And if another doctor looks at my chart and says, oh, you have anxiety, that's what it is, I'm gonna lose it.
I actually used to have this exact symptom, and it was dismissed in exactly the same way for a long time. It turned out I had a bone pushing on the nerve that was helping to feed my heart. So it wasn't anxiety.
Got my heart monitor results back. After a month of waiting, my doctor said it's probably
She got that bone issue because it was caused from the testosterone she was on as a woman for years.
anxiety. But she said because my heart rhythm is normal, it just sits like around the 120s most of the time.
Yeah, resting pulse of 120 beats per minute is not normal. The rhythm might be normal, but the rate is tachycardic, because tachycardia is the medical term for a heart rate over 100 beats per minute.
The highest I got was 170. The other doctor said it's probably just stress, so cool. But with my job, that's understandable. Be responsible for
It's really, really easy to listen to your doctors and think, yeah, I'm just stressed. I'm fine. I'm just stressed. That's why I'm just reacting to my situational stressors. But you got to test that theory. Otherwise, you might be ignoring an actual condition like I was with pneumonia. I kept telling myself it's just normal stress. I'm just having an especially bad week. But it wasn't. I felt like there was something sitting on my chest for a reason, which is that there was something sitting inside my chest pushing out, which would be the mucus and the bacterial bodies.
like 10 people at once, some of them that aren't doing very well and need a lot of help. And I love my job, but it is stressful. And I come home from taking care of people to take care of a toddler.
She's taking care of a toddler. And she's making choices like, wow, I feel like I might pass out while driving, but I still need to go to my job. I'll just take the back roads. It's fine. Was Salem in the car?
But something fun is that I am, as soon as they release the spots for it, getting a booth for the Pride Festival here. The good news is I do have quite a bit of stuff already because I make like one sale a month on my Etsy now.
Now, booth thing is when they put the thing up your butt to, instead of taking the testosterone like the normal way pill form, they put it up their butt. So it's they put a little hole in it and they put it up their butt.
But my plan is chokers in Pride colors. I have lots of stickers already, so we'll bring those. These necklaces, I made like 40 of them last year, so I'll have to make more of them. This is the only one I have left. And then just whatever pendants I have. But that should be fun. It'd be the second in-person event I have ever done. And like I said, I've been stressed, so we're gonna start early on making things. That's kind of what's been going on. And I've tried to make a few videos for TikTok, but I usually just delete them the day after. Thanks for checking in. I'll probably get some art stuff going here soon, just so I don't wait until the last minute in June. Hope you have a good day.
Well, that's our update for Elliot. So thank you for watching, and don't forget to like and subscribe.
Kind of ridiculous. I bet you think that too. I don't know. There's more
Welcome back to
testosterone.
Testosterone Troubles.
The seahorse
I'm
thing.
your host, Exulansic,
Accidental.
and I will be your pedicab driver. Those are the things with the little cart, and there's like a bike, and so I'll be pedaling. I'll be pointing stuff out along the way. I will remind you to tip me. Please tip me. Have you considered tipping me? Because it's really hard to keep pedaling. I'm not a pedophile, so. Anyway, so we're going to be looking at the first of a two-parter. I decided to split them up because I think it's so important to highlight this aspect of her case, that we're going to look at a woman who is identifying as a man, and she got pregnant while on testosterone because she believed
that she was a gay man, and therefore she couldn't.
Okay, this is part of this one. I'm going to go on to the next one, actually.
Welcome back, friends and others. Before we get started tonight, I wanted to just kind of check in. I know some of you were concerned, and I just want to let you know that I've been sick, a little bit under the weather, and so I know that some people were concerned because you weren't sure what was going on.
This is when she had the pneumonia.
But we can all get into straits when we're not feeling well, and so I was having the main symptoms that were contributing were vomiting and fever, and so I just kind of become a bit delirious. I'm feeling progressively better. I'm still not back at work, but I'm hoping to get back to work soon, and wanted to dip my toes in a little bit also with making content again, because I'd taken a break from that as well. So yeah, that's where I'm at. I also have a new article out in American Mind called Genital Mutilation for the Masses. And this article is about a brief overview of a variety of surgical procedures that I've covered on my channel related to so-called gender-affirming care and some of the outcomes it's had for the people surrounding the people getting that care, such as the subject of tonight's video's daughter, Salem. I was quite pleased to see that Jordan Peterson retweeted it along with some screenshots and a picture of a clown, because it was Jordan Peterson's lectures that first made me kind of connect the dots that if I wanted to have meaningful change, I needed to make video content. And I recall him specifically saying that that's something that women should do in particular, because we tend to make career choices that are not scalable. And so video content creation is something that can scale. I could reach a lot more people a lot more quickly. So it's nice that I watched that lecture, downloaded the Cursed Clock app, and then 3 years later, here I am. And tonight, because I was quite recently sick, still getting over the sickness, I'm still on a modified BRAT diet, which stands for bananas, rice, applesauce, and toast. And so I'm going to be having some Marchan instant lunch, mostly because it's just, but it may have been what led to this. And before we really get started, I want to give an extra special thank you to Johnham. You know who you are, to affect the development of the fetus. And so we're going to see in tonight's episode that Salem appears to have some developmental problems, a lot of them, and they're being sidelined and put on the back burner for various reasons.
Whenever I post about Salem, we usually get questions about the little bump on her head. Little bump. So it is a hemangioma, and it's a birthmark, but it's also a benign tumor that has extra blood vessels. It was there when she was born, but it was really small, and it grows usually within the first 3 or 4 months of life. Stays the same until about a year, and then it will start going away. And then it's usually mostly gone by 4 or 5. For most of her life, it hasn't been a problem. But now that she's moving more, she opens it from rubbing it on things. And since it's vascular and on her head, when it bleeds a lot. Just things like the car seat rubbing on it, her like rolling around when she's sleeping. So last week we saw a hematologist, and usually they would have started treatment before now.
Anyone want to guess why they didn't start treatment before now? Did it have something to do with mother's distraction? Or the fact that it wasn't inconveniencing mom yet? But now that it is, they decided to take her in, even though people have been telling her about it for months already, because it's visible in all these videos.
Around 6 months, and she's 9.5 now. We have 2 options. There's a medication called propranolol, but the reason we don't really want to choose that route is it can drop their blood pressure and their heart rate, since it's a beta blocker, and she would be on it for at least 6 to 9 months, 2 or 3 times a day. So we got another referral to craniofacial and plastic surgery. There they can do laser treatments on it to help reduce the extra blood vessels, or possibly even just remove it. Since the base isn't too wide, they don't need like skin grafts or anything, so they might take it off. I guess usually they don't like to do surgeries since they're supposed to go away on their own. But the issue is if it's always open, then there's risk for infection, and she can't be bleeding on things and crying when we dress her because it hurts.
Elliot said again and again that her daughter was screaming for hours and hours and hours, 4 hours at a time, and they didn't know why. But they didn't take her to the doctor about this problem that she's had since birth until it began to inconvenience them because she could move enough to rip it open. Now, supposedly, hemangiomas, the cause is not known, but I was able to find some evidence that placental abnormalities may predict the formation of hemangiomas. And testosterone, while it does not directly cross the placenta, meaning her testosterone usage likely didn't cause sexual developmental problems in Salem, it is known to disrupt placental functioning.
Next week, we're going to go to the plastic surgeons and see what they think. And then we'll have to talk to insurance and see if they'll cover it. Since it's plastics, they might take it as cosmetic. But yeah, that's what it is. You're waving. Hi. And it isn't like life-threatening, but I think it does bother her. So we're going to see what we can do about it.
There's a chance that Salem won't get the care that she needs, even though mom got her nudicles.
Good morning. I am 2 weeks post-op from my hysterectomy. I had my first checkup yesterday, and everything's going pretty well. She did give me some antibiotics to take, but the only incisions that I have are pretty much completely healed. I just have to be careful with lifting for 4 more weeks, and then at my 6-week appointment, they're going to do like an internal exam. But not much news is good news. This weekend should be pretty fun. So Pride is tomorrow, and we're doing some tie-dyeing today. Well, Salem isn't, but she's going to watch. And then Father's Day is Sunday, and it's
For this one, I want to call your attention to the fact that Salem doesn't babble. A baby by Salem's age in Salem, I believe, is 9.5 months at this point. And you have to adjust that a little bit for the prematurity because Salem was born premature according to the other TikToks. So let's say Salem's 8.5 months old chronologically. Although, you know, it's hard to say because we know that Salem has had 9.5 months of exposure to language without the problem of the amniotic fluid in the ear. So one way or the other, though, that's old enough that Salem should be babbling. And babbling sounds like ba ba ba, ga ga ga, da da da. That's called reduplicated or otherwise known as canonical babbling. And after that stage, the child's supposed to transition into variegated babbling, where it's more like ba di ga ba du bu, where it sounds more like speech but isn't quite speech yet. And then from there, you get the first true words. Salem, meanwhile, seems to be at a much earlier stage of development, where she's not even making consonants and vowel combinations of any sort. So she's not even making like a K sound or a B sound. She's just kind of cooing and making noises. And you'll see at the end of this video what I mean. When she tries to speak, it doesn't look like she's...
Now remember, Exulansic is a speech therapist dealing with this issue totally. So she totally knows her issue right here. With little kids that have speech trouble.
Able to coordinate her muscles in an appropriate way. It doesn't look like a typical speech delay, in other words. It looks like there's something seriously wrong here. And we know that this baby, according to this other TikTok that we just looked at, if she had been seen by an appropriate specialist at the appropriate time, treatment for her medical condition would have already begun. So we know that this is a baby who's getting sidelined in favor of mom's surgeries.
It's our first Father's Day. As a reminder, this is the last day that my daisy necklaces are on sale. These guys. And I also have 2 new pendants. This one is swirly with some planet charms. And this one I tried to make more of like a coral reef theme. So it's got 2 different fossils and a little sand dollar charm. Time to do some tie-dyeing. And if you're going to GR Pride tomorrow, we might see you there. Come say hi.
Do you see what I mean? That wasn't a consonant or a vowel. That certainly wasn't babbling. And she seemed to be struggling to get it out. And so as she's like kind of like trying to get it to work, out comes, ah!
Hi.
I want to be clear that I don't know what's causing baby Salem's apparent developmental issues. I do know that they look very concerning. And if a child like that came into my clinic, I would recommend some intervention because it is not a good sign when this is the level of functioning that a child this age is having. And early intervention is very important. We've learned today from these TikToks that the treatment an evaluation for the hemangioma was delayed until it became inconvenient for the parents, even though baby Salem was clearly suffering earlier. And even though the hematologist said, I would have recommended treatment sooner, which is kind of like a, bombastic side eye, I think is what people say. We know that throughout Salem's young life, her mother Elliot has prioritized unnecessary cosmetic surgeries that are extremely expensive, even at the same time as she has to go on TikTok to beg for money for the medical bills and otherwise complain about the fact that she doesn't have enough money to pay expenses, despite knowing that she has an infant. These are very concerning things. They don't add up to a safe picture for that child, in my opinion.
It's time for a baby and art update. Salem is 10 months old. Some new things this month. She's been crawling for about 3 weeks. She can pull herself up to stand on things like us, the couches, her baby gate. She's been waving at people. She also eats a lot more like soft foods, especially banana. She really likes banana.
Notice what's missing?
In terms of the walking, we were starting to walk about 10 months, 10, 11 months at the latest.
Speech. Where's the speech?
She's been handing us toys and then taking them back, and she thinks it's hilarious. Went to Pride for a while yesterday. Met a few people that follow us on here, which is fun. And Salem got a beach ball that's back there. It was pretty hot, so we didn't stay for too long. I also applied to 3 more jobs this morning because Etsy is great, but it's just so up and down. And with student loans, medical bills, and like our rent going up this month, I can't just not know if I'm going to be able to pay it. So hopefully one of those will get back to me. And the plan is that I'll work in the morning, my husband will work at night so that someone's always here to watch the baby.
It's nice that Elliot's finally getting real about having to actually work to pay for expenses. But it's not a good sign that when the resentment is high, Salem becomes the baby. Someone will be here for the baby, the burdensome baby.
Hello, it is day 3 post-op of my hysterectomy, and as a welcome change, this is the only surgery that I have ever gotten as part of my affirming procedures, where I have not gotten comments telling me to not do it because I'm going to regret it.
No, nobody wants you to have another oops baby. That's why no one's telling you not to do it. They're actually prioritizing the child over you.
So that's pretty nice. I'm feeling okay today. Most of the gas pain is all gone now. I've been really tired, but I think this one just kind of feels easier since most of it's internal. Just not a lot of stitches to like work around and make sure I don't open up. All we have is just these little pokes. My surgeon said to expect some light bleeding for the first couple weeks, but after the first day I haven't had any.
The fact that Elliot got a hysterectomy this young.
I agree, Pamela. This is heartbreaking. It's definitely insane, crazy, and they're pushing this on our kids. So it's a woman and a guy living together, and the one woman is becoming a guy, and they have a kid. It's ridiculous.
Let's put her into an elevated risk category for early onset dementia, and so good luck. For that, we don't really know why. It seems to happen. It elevates your risk whether you are you have your ovaries out or not. So it's not just a purely hormonal thing. It's something that's associated with early hysterectomy, and you could make the argument that perhaps that's because of whatever pathology led to the hysterectomy led to the dementia. But of course, as we know in Elliot's case, there was no pathology. This was a gender affirming hysterectomy. So. It'll remains to be seen what long-term impact this has on Elliot and of course therefore on Salem.
Overall, doing really good, and I said that I was going to give myself a few days off work, but I'm not good at doing that because I get bored. Which, speaking of Fred, our local event is in 2 weeks from today, and I think my surgery came at a good point that I will be able to go. So it's a great time. I am mildly nervous to go as I was last year, just since how the world is at the moment. Probably won't be down there for too long anyway, just since we're going to bring Salem. It's a family-friendly event.
Is it? Is it really? All right, that's all I have for this episode. I'll keep you posted. This was the vagina-sparing metoidioplasty anecdote that was featured in the American Mind article. So again, be sure to check that out. You can also see my latest interview on Charlie Simons.
Okay, I'm going to go on to the last one here that's dealing with this.
Welcome back to Metoidioplasty Moments, the show that makes you ask yourself, if it wasn't broke, why fix it? I'm your host, Exulansic, and we're going to be looking at someone we've looked at before who goes by the screen name Pigeons and Fries and is otherwise known as Elliot. You may remember Elliot from the episodes Testosterone Trouble, The Accidental Seahorse, from when she got pregnant, even though she thought that was impossible. And the other episode, Metoidioplasty Moments, She's Come Undone. She's also pops up in a couple of update reels. I will link them below, and if I forget to link them, please remind me. All right, let's get going.
Hey, so I have an update on my bottom surgery, and some good news. Insurance has started processing, so the bill that was $93,000 is now down to about $23,000, which is still a lot, but it was billed in a few parts, so not all of it's gone through, and that number is significantly better than it was.
If you have the same insurance as them, or pay tax dollars.
She's also been raising by donations a lot of the money.
Because I think they might be on Medi-Cal, I'm not sure. Congratulations. You picked up that $70,000 tab and counting.
The second part of the surgery, which is in office, it's just implants. Not like the 6-hour one I had before, but that will be in about 4 weeks now, 4 or 5 weeks. So it'll be good to get that done.
This third portion would be the installation of the nudicles so that she can pretend that there are 2 testicles on either side of the vagina she's keeping.
The third part of bottom surgery that I was going to do is like the internal, like hysterectomy and stuff like that. But that won't be for a while because I need separate letters and it's through a different doctor.
Why, yes, she might become pregnant again while on testosterone at any time.
It also just won't be my top priority.
Because it's not cosmetic.
I did call my top surgeon's office the other day, and
that means that she's having sex with her boyfriend. Why the hell are they doing this? It's insane.
Have to call me back because I guess he wasn't in the office, but I am going to talk to him about getting a revision. Since that is something that is visible and summer will be coming up, I really want to do that first.
It's about the fashion.
Last time that I saw him, he was scheduling out about 6 to 8 months. So this probably will not happen anytime soon, but I do want to get things started since I am expecting it to take a long time. And then there's always that feeding baby and us and rent and things come first.
Baby very clearly does not come first.
My shop has been doing very bad. So obviously if I don't have the money to do it, I can't.
As you'll see, these surgeries rapidly become non-optional because of the nightmarish and predictable complications.
But it has been a little bit rough this last month. That's kind of what's going on though. So I have like 4 or 5 weeks to save up for the next part, the final part, second part of my bottom surgery. And then hopefully I can get in for a consultation with my top surgeon about the revision. And after that, hysterectomy, and then I am done. That is all I've had from the beginning planned. There's nothing else that I would want to do besides that. So the end is in sight. Just
guarantee there'll be a lot more surgeries trying to fix all this crap.
Have to keep working to make it happen.
This person is so fixated on plastic surgery that even having a baby could not disrupt that plan. Who actually believes that she'll be done when her current plan is done? If you can spare a moment, please watch to help a trans person with medical bills. 2 weeks ago, I had to have emergency surgery to avoid further infection and complications from a previous procedure, and our bills have almost doubled. The hospital offers payment plans, but it's still another $350 a month for 12 months. Even with my husband working full-time and me working as much as possible, the bills are getting overwhelming. Since I'm not through an employer, it's difficult to know what to expect, and money depends on performance. I'm attempting to get art out there for the extra needed support. I mainly make wire jewelry, keychains, and beaded necklaces.
Divorce
These
is
pieces
coming.
are part of a Pride collection, but I offer customs. Here's Leo's transition surgery fund, which is short for Elliot. and where to find her art. If you've gotten this far, thank you so much for your views.
There's
I'll
just so
continue
much
to
in
make
this
new places while
trans
healing and
cult.
try my best to get things
They
sorted
won't
out.
accept that
Thank
she
you for
should have
watching,
been
and I hope you
stayed
have a
as a
great
woman.
day.
Him as a guy, and they had a regular family.
Elliot and her husband also just acquired 2 cats in addition to the baby that they are trying to pay for.
So we went from 1 baby to 3 today. And the extra 2 are fur babies, but they're still babies. They're about a year old. I've been talking with my husband and my brother that we live with about getting cats for since we've moved here. Because really it feels weird to not have animals since we've both grown up with them our entire lives. And I would also like Salem to grow up with some type of animal because they are very good at saying no. But someone that I used to work with, her son is moving to another country and they no longer can bring their animals with them. So she was trying to help him find a new home for them. And they have 3 cats. 2 of them are about 1 to 2 years old and they are friends, so they needed to go together. The other one is 14 and is fine by himself. But if they couldn't,
They sure are, Pamela, loaded with the social service with the leftist Democrats. They'll take the kid away for not affirming gender stuff, but they'll push every bit of money at him they can help with to get him going through this whole gender transitioning and having 2 dads when it's really a husband and wife originally before they got pushed all this crap on them.
find a home, they would go to a shelter. And since we were talking about wanting animals anyway, I impulsively, after I saw that post, was like, hey, cats. And less than 24 hours later, we have 2 cats.
Day in the life with a 6-month-old at 3 a.m. Cleaning bottles and getting prepared for the night before bed. Enjoying the quiet minute and playing with cats so they don't wake husband up. Good morning, Salem. Wakes up a few times at night, but she's been a bit better about sleeping. Watching some Peppa Pig. Trying to crawl. Baby's movements don't look right to me. Currently zonked from anesthetic, but surgery went well and we're on the way home. Ya boy got balls. Needle installation a success. But will it stay a success?
All right, today is day 8 post-op for the second part of my bottom surgery. And making updates is a little bit difficult since I can't show anything, obviously. It's not like top surgery where I can show you the healing process.
There's an exhibitionistic element towards this community sharing of their healing processes that is also intrinsically reinforcing because it's a way of getting attention.
There's still quite a bit of swelling. I'm expecting there to be swelling for at least 4 weeks. The bruising has gone down, so that's good. And no issues with stitches coming up in this time yet, so that's also good.
Yes, hence the title of the video that she appears in. She's come undone.
I had my hysterectomy consultation this morning. We talked about also removing ovaries, since while they're already in there, they can do that, and it reduces the risk of ovarian cancer, as well as some other types of cancer. But the downside of doing that would be that there is no estrogen produced. Right now, I don't have much estrogen in my body, but if I had none, there's an increased risk of heart and bone problems later in life, which would mean I would be taking estrogen. I also have to think about if I were to lose access to taking testosterone, if my body was not naturally producing some type of hormone, that would be an issue. At this point, I'm thinking that I'll just keep the ovaries, and then if I ever did have cancer, they can just go back in and take it out.
It sounds like they are presenting the hysterectomy as being risk-free, and the only risks are related to the oophorectomy, the removal of ovaries. But it is known that hysterectomy without ovary removal, leaving the ovaries in, can still increase your risk of dementia. And it doesn't sound like they're suggesting brain problems later in life at all. Is this really informed consent?
So they would just remove the uterus and the cervix.
Last I heard, she's intending to leave her vagina, and there's nothing wrong with the cervix. So why are we removing the cervix? That's going to cause a lot of problems with the pelvic floor function as well as sexual function. But full steam ahead. Just jack-o'-lantern.
Now, usually people would get a hysterectomy before you get any other type of bottom surgery. I'm doing it kind of backwards just because of how insurance worked out. So I do have to go back in a month for an exam. Since my anatomy is different, she has to take a look and make sure that her instruments and things that she needs to use are going to work. It shouldn't be a problem, but it's better to figure out beforehand than when you're in the OR.
I'm inferring from this that she's planning on getting a transvaginal hysterectomy.
I am hoping that will be my last surgery and that after this summer I can just not worry about them anymore. I did get my first statement from last week's surgery, and this is before insurance, but right now it's about $50,000.
And the estimate for surgery 1 was something like $140,000.
Insurance takes their time with everything, so it'll be a while before I get an actual bill.
Just keep making keychains.
Okay, so it has been 2 weeks since my surgery, so I have another update. I said last time things were going really well, and this time we do have some issues, but I'm not sure if they are serious yet or if it's just gonna be okay on its own. I called my doctor today and she was not in office. They had me send in some pictures, which is always a little strange, but necessary since I live 2.5 hours away. They sent them to her and she's gonna take a look tomorrow. And the issue is definitely caused by me. It's my fault because I have to carry Salem around and she is technically outside of my lifting restriction, but
So in her mind, it's entirely her fault that her doctor chose to perform a medically unnecessary surgery on her, knowing that she has an infant to care for at home.
it is.
Who out there thinks that a lot of these doctors should be prosecuted as well? Doctors, the med companies, all of
It
them.
is not possible for me to not carry her when my husband works almost every day of the week. I don't have someone to watch her every day for 8 hours for 6 weeks.
Yeah, but summer was coming up.
Last night, I was taking a shower and realized a little hole. And when I say little, it's like probably a few millimeters, but it is a little deep. And the skin inside is black, unless it's not skin, which would maybe be worse.
Predictable and nightmarish.
The other thing it could be is the implant. Either option is not the best. And this morning, I don't know if you can tell from me holding the camera, I started shaking, and I have just been shaking since. But I don't have a fever, so I'll keep an eye on it and see what they have to say tomorrow.
It's not like you're risking the life of your child's mother.
My post-op appointment was originally in about 10 days, I think. Maybe it's a week now, I don't know. They might have me come in sooner. I'm just hoping that they don't have to like take the implant out. Or that I don't have to have a different surgery to fix it. Best case scenario would be that it heals on its own. There are risks to every surgery, and sometimes things get worse before they get better.
That's why you don't have unnecessary surgery. It's because stuff like this happens. Stuff like this is always a risk. These are the surgery installed nudicles so that you could have pretend balls.
Or they look worse and it's actually okay. The risk of complications
she
from
will
my first
need a lot more
procedure were
surgeries.
50%,
A
and
lot
nothing
more.
happens.
If nothing happened, why was the title of that episode She's Come Undone?
So that was pretty lucky. If I start feeling worse, I'll just go to urgent care downtown. But I will avoid that as long as possible since I can't really afford it.
So you knew that this was a possible outcome of the surgery, and you signed up for it anyway, despite the fact that it was medically unnecessary and therefore not urgent. And you did this all because you like to gamble? Is that what I'm hearing?
We'll hope for good news tomorrow and that I stop shaking. Quick story time from yesterday. It was a long day. We left home at about 6 in the morning.
And
we got
yes,
back
there is
at
no going
5
back.
PM,
Once they do this,
and
they
it's
can't
about
reverse
2.5 hours away. When we got there, she took a look at my incisions. I was like, yeah, that's got to come out.
Obviously, genital surgeries are more likely to cause infection, which is why it's generally not a good idea to do cosmetic procedures there that are not medically necessary. Got a lot of sources of bacteria that are intrinsic.
I guess there was a high risk that there would be a further internal infection, and that would be bad.
Yes, sepsis is bad.
So she sent some prescriptions over to a local pharmacy, and we went, and it took an hour and a half to get them filled. Salem was with us. Kind of just walked around and tried to entertain her. But once we had the prescriptions, we had to go right back. And this wasn't planned, so they're like, we'll just squeeze you in because it needs to happen. We got back, and they took one out. And during taking the one out, they said, oh, the second one has to come out too.
It's not clear to me whether the labia are already stitched closed, forming a ball sack, or whether these are two independent pouches. But regardless, the other one has to come out too. Meanwhile, like, she's just like shaking uncontrollably, apparently.
I got a big goodie bag of stuff, like sterile water and gauze and packing. So since they took the implants out, there's like a hole. They left a hole open for draining. I have to pack the wound twice a day to make sure an abscess doesn't form, and that way it can heal from the inside out. Then I have to go back next week to get checked out again. I'm not exactly sure what happened.
You don't know what happened? You got a cosmetic surgery on your genitalia, which is next to your urethra, your vagina, and your anus, all of which have bacteria coming out of it regularly. And this wound that didn't need to be created there, that was created there, got infected, and possibly also your surgeon messed up.
They put it down as a mechanical breakdown of implanted prosthesis.
Aren't these made of silicone? What is mechanically breaking down here? Did you forget to replace the alternator or something?
So yeah, that really sucks, and I'm a little worried about what yesterday is going to end up costing, since, I obviously didn't plan for that.
So they will quite flippantly say, oh, every surgery has complications. Every surgery has complications. There's always a risk of complications. But they're repeating what they've heard. They haven't fully processed the implications of that, which is why when complications do happen, they're like, oh, I obviously didn't plan for this complication. Well, then what did you mean saying, oh, there's always a risk of complications? Why wouldn't you plan for that if you thought it might actually happen to you? They don't think it'll happen to them because they're young and naive and hopeful. And gender Jesus would never lead them astray.
Every single one of them have complications.
And if he does, it's their fault for picking up their baby.
Still wasn't worst case scenario. I didn't have to stay in the hospital.
Worst case scenario is that you die. Second worst case scenario, which some would consider a fate worse than death, is that you survive with a horrific brain injury that leaves you completely dependent on other people and unable to process even the most basic sensations. There's a whole lot of things that can happen that are much worse than having to stay in the hospital. But it's completely beyond Elliot's comprehension.
And they gave me antibiotics to take home, and I already do feel quite a bit better. I think my plan for now is to finish healing and try not to have any more infection with this surgery. Continue with my plans for the hysterectomy in a few months, since all of that is lined up already. And then depending on how this heals, if it looks okay how it is, I won't try the implants again. But if it heals and we think that it's safe to try it again, possibly in the future, I would like to, depending on how the results turn out from now.
Salem came this close to either losing her mother or losing a mother who was not profoundly disabled, relying on 24-hour care, possibly without hands or feet, living in a nursing home. This close. And her mother is eager to do the exact same behavior that almost cost her everything, again, as soon as humanly possible, regardless of even the financial cost.
But planning and saving for 3 surgeries and ending up with 5 is quite a bit different. And if you're not sure what's going on up to this point, the whole thing is in the playlist of videos that this will be in. Or if you don't want to watch all of them, I have a surgery fund in my bio, and I don't expect people to donate, but the entire story is there. So that's kind of a summary of the entire thing so far, and would be quicker to read than go through the playlist. Unfortunate turn of events, but again, this is the first complication that I've had.
No, it's not.
Better be safe and try again later than risk sepsis or
They
something
sure have messed
from
her up.
just leaving them there.
Sepsis was a risk now because it's going to be a risk later because you're cutting your genitals.
That's all I got for now, so I'm going to go lay down again, and I hope you have a good day. Hey, so I had another post-op appointment today. It has been a week since my 3rd bottom surgery, and luckily today things are looking a lot better. My surgeon said it's going to take about 8 weeks to heal completely, but she did okay me to get the hysterectomy at the end of June. Since it's laparoscopic, they're not in the exact same
So far,
area.
3
So when they
surgeries
took
to
the
fix the
implants
first
out
one.
last time, there's like a 1/2-inch opening. I've been packing the wound so that it doesn't heal on the outside and then have room for infection on the inside. When this heals, I have a couple options. I could either leave it as it is if I'm okay with how it looks. We could try the implants again, or I could do tissue expanders and then the implants to see if that would work better.
So we're already talking about a surgeon who did a medically unnecessary genital surgery on a woman who she knew had an infant at home that she was going to need to pick up regularly. So already we're not talking about perhaps the most ethical of surgeons. And The nudicles that she installed, the fake testicles, became severely infected pretty quickly. Maybe it was a coincidence. Maybe she did it on purpose because she turned right around and upsold her to not just have a replacement procedure, but we'll do another procedure in the interim in order to make there be a less chance of it. What is her actual motive besides that we're just going to trust that she's a good person to not do this, to not sabotage her own work in order to upsell for additional procedures?
I'm kind of thinking it might be best to just not try that again.
You think?
But it depends on the scarring when everything is healed and how it heals and just how it ends up looking.
They're cosmetic. It's about the look.
Another update is that insurance has started processing. The second surgery ended up being about $45,000. About $6,000 is still pending, and I know that I owe $1,800.
Your premiums are covering this cosmetic surgery.
I have a little over a quarter of that saved.
This woman that makes keychains for a living, who just had a baby because she thought that she couldn't get pregnant while she was on gender affirming medicine, has a little over a quarter of $1,800, which would be about $450 saved to put towards her $45,000 procedure that was the second of now 5 procedures.
And I was thinking to put the rest on like a payment plan, and then the third surgery happened unexpectedly, so I'm a little stressed out now. But there's a bit of time to figure things out before it will like go to collections or whatever. I think maybe 3 months. So yeah, we'll get that figured out.
This seems extremely optimistic.
Next update I have is I was talking about my Pride collection and
Or
making sticker
impossible.
sheets. I finished both the designs, so I'd like to share them. So my first one is rainbow themed. It's got some little Pride flag colors on here, and all of the things on
She's
here.
raising a lot of money in the
I think
trans
is my
community.
favorite. Both sheets have
All the
7
trans
big
trying to help
stickers and 6
support her
small
go
ones.
through this stuff
Second
to
sheet, and these
become
are
a
all in
dude.
trans Pride colors.
Notice how core to trans pride is a drug reference.
My idea for these is to, when I post them, which will be June 1st, for
It's
the
the ones
entire
that are
month
gonna
of
buy
June,
it.
whenever one of them sells, half of the profits from the sticker will go to the Trevor Project. That way I can kind of give back to the community a little bit. Hoping to be able to order those next week, but it also depends on like the whole
Little
medical
kids
billing
could draw that
situation.
stuff.
So I'll get that worked out first and then focus on stickers.
Remember how she said her baby comes first?
I have a consult for a hysterectomy the last week of April. Lots of surgeries, but I need to get them all done soon before the US decides that it's illegal. Salem has her first tooth coming in, which also means she does not like sleeping. She has a consult for a helmet for her plagiocephaly, the unshaped head, next week Friday. So she will probably have a helmet that I will decorate with cute stickers.
Remember talking
My
about the
keychains
cone
have
head
not
look?
done as well as I thought they would. So let's look at those. And that's all I have for now. I'm going to bed. Good night.
That's a condition that I'd actually commented on in the She's Come Undone episode.
And I'm not going to put her on her stomach right now, but I have a video.
Baby seems a bit cone-headed. But I said that the baby looked a bit cone-headed. And so plagiocephaly is a condition where the baby's skull is misshapen, and this can either be congenital, meaning the baby is born with it, which may point towards developmental disruption due to the fetal testosterone exposure, or it's something that can be acquired after birth as a result of being left in the same position for too long. When it's in the acquired form, it's generally considered benign and something that can be treated. If it's congenital, that can point to other issues. So it's unclear where that stands today. If you like what you see, please be sure to give me a like, a follow, leave a comment if you want. If you feel moved to support me, you can go to any of the options on Linktree. It's LIN.
All right. Well, hopefully you enjoyed it all. Get over to Rebel Chicks. They're on now. They should be a few minutes ago. They started. Again, programming note. I should have someone running for Congress on Saturday at 5 p.m. and then early part of next week I have someone running for the Senate. All right. Take care, everyone. God bless. Thanks for sitting through this. I tried to time this out so it came out at 7, but it didn't exactly. All right. Take care. God bless. Bye-bye.